Okay, hello everyone, and welcome back to Common English Mistakes. Don't just learn, improve. So today we're going to look at a rather funny mistake which students make in my classes when they talk about medicine or health. It's the kind of thing I really like because while what they say is technically correct, it's not appropriate for the situation and is very, very unnatural. So we'll look at what that is, what you should say instead, a couple of other mistakes that people make, some key vocabulary and language which people often don't know, and finally a pronunciation issue with a very specific word. So anyway, the mistake is up here. When I have a headache, I take pills. So just pause the video, see if you can make that sentence more natural. And well done if you said either I take painkillers, the type of medicine, drug, or just the name, ibuprofen, paracetamol, or Nurofen. So this here is a pill, or you may call it a tablet, and you may say it's easier to take a pill with a glass of water, or the pharmacist may tell you take half a pill twice a day. However, if you talk about pills, and especially the phrase take pills, I'm thinking something illegal. Either at a rave, a dance party, or maybe something like prescription medicine. A lot of people these days are addicted to pills, like OxyContin. So generally, you don't want to say take pills. Other students say they take medicine when they have a headache. This is maybe better, but again, not the natural thing to say. Medicine, you want to use in a very general sense. I need to pick up some medicine from the pharmacy, or what medicine do you take when you have a headache? A bit more specific is medication. When there is a specific medicine, you're just not saying what it is. My grandma takes medication for her arthritis. And with this one, we also have a useful phrase on medication, meaning you are taking medicine. But when we want to say someone takes a specific medication, generally we do one of two things. Either say the type of medication. Generally, this is going to be the same as in your language. Just watch the pronunciation. Antibiotics, antihistamines, statins, insulin, etc. However, if it's a normal, everyday, or what we call over-the-counter medication, most naturally, just say the name of the drug or the name of the brand, making sure that's capitalized. So when I have a headache, I take ibuprofen, paracetamol, or the brand Nurofen. All of those are called painkillers. I'd use that maybe when you're asking a question. When you have a headache, you ask, do you have any painkillers? And it's the same for other things. If you have a sore throat, technically you would ask for a lozenge, but people don't really say that these days. I'd say they just say what they take. In my case, I take a Strepsil. Or when British people have a cold, they often take or drink Lemsip. This medicine you make into a drink. You probably have an equivalent in your country. It's most natural just to say the name of this drug or brand. So that's probably the main mistake I hear. It might seem like a small thing, but if you use the name of a drug or brand, you're going to sound much more natural. Let's now look at 3 other mistakes my students often make. Just pause the video and see if you can correct any. And well done if you said, we say a cold, a virus, or a bug. It's quite a colloquial term for a minor illness, but we say the flu or just flu. With other more serious, less common illnesses like COVID, yellow fever, diabetes, malaria, or cancer, generally use no article. And then for the next one, like we do with body parts, I broke my arm and went to hospital, make sure you use the possessive adjective for anything relating to your body. So, the nurse took my blood pressure, you get your vision tested at an optician, and during COVID, we had our temperature taken a lot. And then the last one, maybe students make because they don't know the specific word. When you break your arm, you go to hospital because it's an emergency. But for non-emergency issues, you go to either the doctors, the clinic, or maybe the surgery, British English. So let's now move on to some key language which students often don't know. Firstly is the verb treat, meaning give medical attention to. Either you say a doctor treats a patient or someone, the doctor treated our son, or you treat an illness or injury. Do you know how to treat a fever or a burn? Or you can treat an illness or injury with something. And it's quite useful because it doesn't always need to be medication. I treat a cold with Lemsip, but also rest, and my personal secret, ginger lemon honey tea. So now just pause the video and see if you can guess what the following nouns in yellow, adjectives in blue, verbs in green, and phrase in purple mean. Well done. If you said an ointment is a medical cream, you could just say cream there. And a rash is a red mark on your skin. And then if you cut yourself, you need either a plaster in British English or a band-aid in American English. The noun is also cut, unless it's a very bad cut, and then it's called a wound. And if you have a wound, you don't need a plaster, you need a bandage, and probably to go to hospital. And then if you break your arm or leg, the doctor will probably put it in a cast to protect it. And if you break your leg, you'll need crutches to move around. A less serious injury than a broken bone, but still quite bad, is a sprain. This often happens with your ankle, and people often say they twisted their ankle. And when this happens, or a broken bone, it will swell, get bigger, the verb. There will be swelling, the noun, or it will be swollen, the adjective. And when you break a bone, sprain your ankle, or someone hits you, it will bruise, or you'll have a bruised arm, for example. And finally, I really like this collocation. You can invest money to boost the economy, or say nice things to people to boost their self-esteem, make them feel better. And I eat ginger to boost my immune system, give a push and increase my immune system. So like I said, those are often words which students don't know. Do take a moment to review them, study them, because they are quite useful. So finally today, we're going to look at a pronunciation issue with this word, ache, which means a long, dull, or general pain, as opposed to a short, sharp pain. Generally, the problem here is that students say the letter H, whereas we want a nice strong K, ache. But also students have problems when they have to put it together with another part of the body, for example, head. What I find is students say them much better when they push the sound onto the second part of the word. For example, if I write it like this, headache, headache. So just pause the video and try saying these words as they're written on the right. And well done. If you said headache, toothache, earache, muscle or joint ache, that one I think people are okay with because it's two words. Backache, Students kind of like that one because it's got the word cake in it. Heartache for when it's emotional pain, maybe after a breakup. And then the last one causes particular problems. Firstly, you need to know how to say stomach, not stomach. And then if you want to say that pain, say stomach cake. If you say it like that, stomach ache, you're going to sound much better. So anyway, explanation over. There's no practice and improve today, just today's questions. What do you take when you have a cold? Use the name of the drug or brand to answer that. And do you treat it with anything else? Rest or maybe a drink that you make. So do write your answers in the comments, guys. A good opportunity to practice an area of English which is useful, but we don't study a lot. Anyway, that's basically it for today. Hopefully now you're going to be much more natural when talking about medicine and health. If you haven't done so already, check out the other video I did on phrasal verbs with health. Remember to like, subscribe, share the videos with others, and I'll see you for another video in the next few days. Till next time, see ya.